All right, good morning, everyone, and welcome to day 2 of the Michigan Environmental Justice Conference. Glad to see so many people joining us this morning for our first session of the day on public health equity. My name is Jim Ostrowski. I'm with the Michigan Department of Environment, Great Lakes and Energy's Environmental Support Division, and I'm just going to go through a couple housekeeping guidelines for those of you who might not have been on our sessions yesterday and don't know, about this. First of all lines are muted in this webinar and all the sessions you'll be hosting. This session is being recorded, and we're posting those online as soon as we can get them up there. Pretty much all the sessions from yesterday are already up and on the Whova app and on the agenda or on the event website. If you go back and look, if you missed any of the sessions, you should be able to go back and watch the recordings because they should be up there. Also, if you have a question today for the session, you can type it into the questions, the Q&A box on your Zoom toolbar. We'll be getting to those towards the end. Also, if you're using the Whova app, I don't know a lot of you are using the Whova app, which is what we're using to engage attendees during this webinar or during this conference. You can type your questions in there as well, and we'll be monitoring those. So with that, I'm going to turn it over to James Bell with the Michigan Department of Health and Human Services. James, go ahead.
Good morning, everyone, and welcome to day 2 of the Michigan Environmental Justice Conference. As Jim mentioned, my name is Dr. James Bell III, and I am a state assistant administrator within the Michigan Department of Health and Human Services. And part of my role includes oversight for our department's lead strategy as we have prioritized a reduction of lead exposure for children by identifying risk factors at the local level, improving the identification and monitoring of lead-exposed children, and targeting services and resources to localities. And what we've observed through deteriorating lead-based paint from older housing and potentially through drinking contaminated water resulting from failing lead pipes tells us that lead poisoning is an environmental justice issue worthy of public health attention and action. And there are so many other hazards that we as a department play a role in addressing and mitigating. We find ourselves here today because we recognize the social determinants of health are just as important as the biomedical aspects of health. And as EPA Administrator Michael Regan suggested yesterday, the social determinants of health are often described as the conditions in the environments where people are born, where they live, work, play, worship, and age. And the way that I've come to think about the social determinants of health and one's experience of those determinants are really based on the qualifiers. Do you have safe and affordable housing? Are you receiving quality education? And is your air and water safe? The social determinants of health contribute to wide health disparities and inequities. And as you'll hear today, one's neighborhood and physical environment plays a critical role in potential health outcomes. And just promoting healthy choices will not eliminate these inequities or these other health disparities. Instead, public health organizations and our partners in sectors like education, transportation, and housing need to take action to improve the conditions in people's environments, and hence today's presentation and public health equity. As we were structuring this morning's conversation, we wanted to find the right balance of policy and practice when it comes to the intersections of health equity and environmental justice. And so I'm excited to share the virtual stage today with some phenomenal women. We have Dr. Jonee Khaldun, Chief Medical Executive and Chief Deputy for Health for the Michigan Department of Health and Human Services, Courtney Davis, Deputy Health Officer for the Berrien County Health Department, and Poppy Hernandez, Equity and Inclusion Officer to our Governor, Gretchen Whitmer. And so for this morning's format, we have a few questions to get the conversation started. And I would like to also re-invite you all to use the Q&A feature to ask our panelists some questions that we can have answered at the end of today's presentation. So if I could have Dr. Khaldun, Courtney, and Poppy all turn on their cameras, I think we can go ahead and get started. So the first question I want to ask goes back to kind of this idea around the social determinants and understanding the role of social determinants of health. Why would public health be well positioned to advance environmental justice? And Dr. Khaldun, I think we can start with you.
Sure. Good morning, and thank you, Dr. Bell. Really excited to be a part of this panel this morning, talking about really important work that we're doing in the health department So I'll say, I'm a practicing ER doctor, and one of the reasons why I spend most of my time actually working in public health and policy is because, quite frankly, there's only so much you can do within a hospital or doctor's office's kind of walls. And it's well known, it's been established that most of someone's health is determined by, as you said, Dr. Bell, the environment in which they live. So whether they have clean air, clean water, safe places to exercise, places to play for their children. And so absolutely, that is what public health is about. It's about bringing people together, creating the conditions for them to be healthy, promoting health. And absolutely, you can't do that unless you are talking about environmental health and environmental justice, quite frankly, as well. And I'll just say, I think one thing we've learned from the COVID-19 pandemic is that the work of public health is not just about the work of the public health department. Everyone has a role to play in public health. And so if you think of it that way, we're all kind of playing a role. This conference is being hosted by Eagle, but Eagle, as far as I'm concerned, is a public health agency as well. And so they've been just great partners throughout all of this incredible work. So that's my perspective.
Thank you, Dr. Khaldun. Courtney or Poppy, would you like to add?
Yeah, I think just to build on that, I think that was absolutely where I see and believe public health has that role as well. And just to kind of build, I mean, public health are conveners. We bring the partners together and have a network of cross-disciplinary people and organizations. And I think that is really key when we're talking about assessment and planning work, being able to have that broader reach and that broader input is just really important. So I think that's just the other basis of why public health is so positioned to do this. Place matters, and then people at that table matters. And it's that role to bring all of those individuals together.
I will just add on that, yeah, I agree with the remarks that have been stated. I think, to put it simply, public health is sort of the singular entity that has its eyes on all of the pieces that make it possible to build healthy communities. So the various community-based organizations or even state entities that are regulating public health, as Dr. Khaldun perfectly stated it, like Eagle, maybe don't have their eyes on all of the pieces in the way that a public health entity does. And it also is uniquely situated because it has the really strong local sort of home, but also has the broader regulatory dynamics of a state. So I think public health is the place where this lives, this equity piece lives. The other thing I would add is that it also has this unique opportunity to sort of push in a population-based lens. I think my work in local communities was really driven by these sort of individual needs, goals, priorities of any specific entity, meaning like, what's the target population that we're trying to reach, or the target community that we're trying to reach. But public health pushes in and says, we don't just reach one community, we reach the whole population. And that's how we measure success. So I think having public health at the forefront of equity work is essential for moving from silos to strategically smart work.
And Poppy, I really appreciate the way you framed it as far as where public health sits and the relationship between equity and environmental justice. And so now I think that segues perfectly into my next question. And how do you describe that relationship for health equity, environmental justice? Because I imagine there's similar goals, but the approach may look a little bit different. So Poppy, if you even want to take that question to start it off.
Sure. So my work in public health was really interesting, specifically related to this question, because my work was largely driven by prevention work. So prevention specific to, for example, substance abuse and risks related to unintended pregnancies and STIs in the state of Michigan. So I had a pretty narrow lens, one might think. but we actually really talked a lot about our work in terms of the environmental strategies. And so what that means, just translating, because we can really get into our jargon very easily, is we change the impact for communities by changing the environment. And when I first started doing that work, I thought, I didn't get into this to do environmental work, right? That's kind of because I thought of it in these really different terms. But when we talk about changing the environment, we are talking about thinking about it from this holistic perspective. We can't expect people to make healthy choices around food if we aren't creating access to healthy food. We can't expect people to have healthy choices around drinking water, right? Even just the consumption of more water. It's a simple thing, right? But we can't, like, we could do all the education and community organizing and things around consuming more water if they don't have access to clean water. So we really have to think about it from this broader lens. What are the systems and infrastructure opportunities that we have to, I always talk about it from this perspective of a current. How do we create the current that captures the most people for the best impact? Right now, what happens is we have currents that capture some people, don't capture all the people, and that's how we get the disparate impact across in terms of health. So I hope that makes sense, James, but that it's really about not thinking in silos. It's really about what are all of the pieces that need to come together and how can we work collaboratively to create currents that capture the most people.
I love
Maybe
it.
if I can, Dr. Bill, I'm sorry, I'm interrupting. I'm getting all excited here. I just want to build on that and really kind of level set on this issue of equity. Because the fact of the matter is, when you're doing this work of environmental justice and striving towards health equity, if you don't understand why there are inequities, then you won't be able to actually have a significant impact on the problem. And it goes back, it's historical, systemic injustices. You can talk about redlining, you can talk about lack of resources being put into particularly communities of color, you can talk about racism. And so those are the reasons why we know that some people, based on literally who they are and the systems that have been put in place to remove them from access to particular resources, that is the reason why they are not set up such that they can have optimal health. And so when you talk about putting that into practice, it means that sometimes there may not be equal attention paid to, I shouldn't say attention paid, but equal amount of resources put into every community, because every community doesn't start with the same amount of resources in the first place. So when you talk about policies and dollars and how you're putting programs in place and where you're putting those programs from an equity lens, it may mean that some of those more marginalized and minoritized communities may have to get more attention and resources placed so that they can have the same opportunity to be healthy.
Yeah, I don't know that I have a lot to add. That was a really thorough and great response to that. I think the things that I picked up on, and Poppy, I heard you say currents and silos, and I think that is definitely where we often find ourselves. Is we see the social determinants and we are focusing in these silos, right? We want to focus on healthy eating, or we want to focus on active movement. And we don't often link those things all together to look at that broader global perspective and kind of interline those currents. And I think that when you think of environmental justice and health equity, they are intrinsically linked, right? You cannot address one without the other when you're looking at it from a public health, from that community perspective. And I mean, when you try to do that, you're just kind of perpetuating that cycle and that trauma and that system. And I really appreciated Dr. Khaldoun, that you bring in kind of that historical trauma. If you follow both environmental justice issues and health equity issues back, I mean, you come back to that structural racism, the bias in the systems of how that is impacting our communities. And I think that that's where we find a lot of the aspect of our bodies keep that trauma and what we see those downstream health impacts. And I think when we can acknowledge that they are intertwined and bring those partners together, that's when we're going to be stronger, when we don't look at those siloed systems.
And so I'm glad that you all have brought up kind of the root causes of inequities. And Dr. Khaldun, this question is specifically for you, thinking about the other roles that you have and coming from a medical background. How does implicit bias in healthcare intersect with environmental justice?
Yeah, I think the fact is that these same marginalized and minoritized and medically underserved communities that have all these unjust exposures to environmental things. So poor air quality in Southwest Detroit, for example. That was Southwest Detroit. I spent some time living in Philadelphia. It was the same type of thing where people who were more underserved, marginalized, lived right next to where you saw the smokestacks and chemicals going into the air in Philadelphia on your way to the airport. So I think it's just a lot of the same communities not receiving the resources that they need to have optimal health. And so when I think about the intersection between that, the medical bias and environmental justice, I don't know if you all recall with Hurricane Katrina, there was a really terrible comment. I didn't hear it firsthand, but it was in the media at least, from Barbara Bush. And I think that, again, this was a while ago, but I think there was something around, well, these people, they're in this dome, but they're used to being underprivileged and underserved. I'm paraphrasing here. So this is actually working out well for them. And I think that really resonates with me when I think about bias, because every human being by nature has bias. But when you're talking about how your biases play into how people receive medical care, your expectations for how they perceive pain, whether or not they will get a particular medical procedure, whether or not you're going to pay attention to them when they're complaining about whatever it may be in the postpartum period. We know we've got disparities in maternal mortality between Black mothers and white mothers. So I think all of those biases play in when you're talking about what things do minoritized, marginalized communities, what do they have access to? How do biases, whether it's someone thinking that it's okay for people to be together in a dome in a hurricane, or whether or not they receive access to appropriate high quality care in a medical facility, I think it all relates to, again, this issue of health equity and making sure whether you're in the medical field or talking about environmental justice, you are making sure you're bringing forth the resources and addressing those biases for these communities.
And so I definitely want to address the pandemic in the room, right? How we think about COVID-19 and how it's exposed and in many ways exacerbated many inequities in Michigan communities, especially our underserved and minoritized. Environmental inequities, we realize, are really no different. And how are we as a state addressing these challenges to achieve equity?
Well, that's for me.
I was going to try to help you, Dr.
Oh, go ahead, Poppy. Go ahead.
I think I actually love this question, Dr. Bell, because I think that what we're doing as a state is we're asking the really difficult questions and we're not settling for easy answers. And so in order to address issues around equity, you have to ask the questions and be open to the answers that have sort of been buried, is the simplest way I can put it. And they've been buried. Dr. Khaldun talked about implicit bias and how that sort of shakes out across our systems. When we think about implicit bias, we think about it as this sort of passive response to inequity and injustice. But I would argue that implicit bias is heavily entrenched and that it is actually required to maintain our systems of inequity. And so in order to undermine it, we have to really shake things up and get really uncomfortable, or it's going to be protected, because the inequitable system, well, it's not even just about equity or inequity, it's about systems are built by these strong bureaucracies. Ours happens to be built on inequity. And so that bureaucracy protects itself. So you have to be willing to shake it up and do things that make people really uncomfortable. So relative to your specific question, there were many of us that worked in the state when the pandemic hit that, I mean, I'm guessing Dr. Khaldun, with her experience in the ER, she immediately went to how is this going to disparately impact specific communities? Because we have a really, we have a gift in Dr. J in the state of Michigan. I mean, many of us know this already, but the fact that she has this direct experience in the ER as a provider, right? But then this public health picture, that's not a package that happens all the time. Am I right? I mean, for everybody on the panel, I'm correct here, right? So we had this really unique gift because her lens was going to go right to who's going to show up disparately in my ER room, in my ER, right? So for those of us that were working across the state, specifically in the governor's office, many of us were thinking, what's going to be the disparate impact of this pandemic? And so for me in my own work specifically, my brain went immediately to the most vulnerable populations, the populations that already have inequitable circumstances at work in their everyday lives. And my brain immediately went to migrant farm worker populations, because we already know that they were incredibly vulnerable even prior to the pandemic. They live in very high risk circumstances. And so there were several of us that immediately thought, wow, this virus is very easily spread through close contact. It has a disparate impact on folks that are not strongly connected to healthcare infrastructures. It's highly, the spreading is highly, what's the word I'm looking for? Exacerbated by a lack of access to sanitation and being able to wash your hands. And so we knew that migrant farm workers were going to be disparately impacted by this virus. And so we immediately talked about what are some of the mechanisms that we needed to fold in, because we knew the workers were going to be coming to the state of Michigan. We knew when they were going to be coming. And so we looked at this population-based approach. How could we capture the most people that were potentially going to be disparately impacted, and who were the partners that we needed to get the work done? And so we pulled in, Courtney worked very closely with us on that work. Local health departments, we pulled in FQHCs because we knew they were going to be able to respond to the needs around testing and access to healthcare. FQHCs, for those that don't know, are the local clinics that are the community-based clinics. So in Grand Rapids, that would be Cherry Health. So everyone knows they're local community-based health clinics. And we partnered with them and we worked on it, and we built in this structure that really forced our collaboration across discomfort, because we all have our ways of doing things, but because we had this really specific focus, we were able to stay on track and respond. And the work was powerfully impactful in two ways. One, we saved lives of people that would ordinarily be at very high risk. And two, we protected our food system, which is very important to our entire population. So we had this very, what I would describe as unusual approach, which said, how can we be equitable in protecting folks that are operating in inequitable situations? And then we just pushed in. So it was very exciting work. I'm super grateful to have been part of it.
Maybe I'll just add, oh, sorry, no, go ahead.
Oh, I was just gonna say, and I think just to add to that, I mean, the other things that we've seen as we're addressing that is we've talked about, you know, where you live, you work, you play, you worship matters. And so we've been able to see things like eviction not happening or water shutoffs. And those things kind of go back to Dr. J. You were saying, you know, sometimes with equity, there are communities that need more poured into them to make that stronger base, to be able to make those things. And I think being able to have some of those on the ground things and asking the questions of who is impacted, what is the need, and what can we do about it, and being able to use policy to then drive that forward. I know, at least from the local level, we ask those questions, and that policy piece can really help leverage partnerships and abilities to serve our residents. And so, I mean, along with, Poppy sharing about the work that happened with testing and now vaccination in our vulnerable communities, I think some of those other policy pieces being in place that address both the social determinants of health and equity and some of our environmental inequities have been really key to, as a state, protecting our most vulnerable residents.
Yeah, I agree with what's been said. I'll just add, I think it's important to have leadership, intentionality, and then action, right? It's not just enough to declare racism as a public health, crisis, for example. That it is, and that is important. And I'm very proud that our state, the governor, has declared that. But I'll also say that it comes to what we've also been doing in the state, right, which is being intentional. So we were one of the first states to actually say, well, wait a minute, what's going on with race and ethnicity when it comes to COVID-19 cases and deaths? One of the first states to kind of identify the disparity, which is not a surprise, publish that data, but then taking action. And we've been intentional through our Racial Disparities Task Force, proud of the leadership of Lieutenant Governor Garland Gilchrist as well, who chairs that Coronavirus Disparities Task Force, intentional about placing testing, like literally, where are the high social vulnerability index neighborhoods? We literally have a map where we said testing needs to go here, here, and here. Same thing for our vaccination efforts. We know everyone, especially early on, limited supply, high demand, but we were very intentional about, we are going to save an allocation of vaccines, and we are going to put those vaccines only into places where there are clear community partnerships, where we know they're going to be in our most marginalized, minoritized communities, so that those folks have access to vaccines as well. We know some of that work also doesn't go as quickly, right? It's not the mass vaccination clinic, but it's really important. And so we actually intentionally in Michigan kind of said we want to go fast, but we have to do both. We can't ignore equity at the sake of just getting shots in arms, because we know that a lot of folks were driving wherever for vaccines to be able to get those. And so we had to be intentional with our equity efforts there as well.
So I was writing down some notes: leadership, intentionality, and action. That'll be my mantra going forward. Courtney, I would love to hear kind of from the local health department perspective how environmental justice shows up in discussions for practice, and also thinking a little bit ahead, how are we onboarding the public health workforce and practitioners to have an eye for justice?
Yeah, those are great questions. And I think a lot of the conversation we just had, and especially Poppy sharing about, the partners around the table and the questions we asked, that is how environmental justice shows up in discussion for practice. It's really digging deep. It's asking the uncomfortable questions and being comfortable with discomfort, or getting comfortable with discomfort. I think that this is where, on the local level, it's really digging deep and expanding your network of partners. I think when we talk about public health partners, we often say, traditional and untraditional partners. And I think a lot of our untraditional partners, our other nonprofits, our faith-based, have become more traditional, and it's getting even more granular and more deeper. Who are those community think leaders, those activists, those advocates? And how are you ensuring that when you are making a program change or a service change, or making some of these decisions when we're talking about pandemic mitigation measures and what should happen in schools, that voices that are being impacted are at the table, and it's having those all-inclusive conversations. I think one of the hard parts about this is it takes time, and we often want to make those quick decisions. We want to move fast, and that is important, but it is also important we don't move so fast that we leave out the important information as we go. And I think that is where having those partnerships before you need them is important, right? If we're just calling on individuals when a community has an action level exceedance, when the pandemic hits, we've already kind of missed the boat, right? These should be ongoing things. When we're making changes, even to something like our WIC clinic and food access and how that's going to happen, do we have families, do we have moms and dads at the table who are impacted by those decisions saying, this is where we're going to have those partnerships for that next thing that happens, right? Then hopefully the next pandemic, far off, but having those partnerships already in place. And then making sure that that impact and voice is what's driving your decision. And I think that's what happens at the local level, right? Asking those really hard questions and being okay that, yes, you might be the expert in the room, but experience is also expertise. And are you ensuring experience is driving that decision? For workforce, I mean, I think this is where the crux of it is, right? We can make the declarations, we can have the resolutions, but we actually have to do the work. And that has to happen more than one or two deep in an organization. That really has to be present in every decision and every work you're doing. So, I mean, as simple as when you're interviewing, how have we kind of, at least in Berrien County, worked questions about equity and health disparities into our interviews? Already gauging right off the bat, what is that understanding? Sometimes, you get that textbook answer, but also looking for that lived experience. And how are you ensuring that you're bringing someone onto the team that values that lived experience and having that communication? Even with our current workforce, public health has a lot of incoming, but also a lot of current workforce. How are we spending time addressing bias and unconscious bias in the work that we're doing to ensure that the right choice is being made? How are we building awareness? And not only that it's important, but that it's an expectation that community voice matters and will be included. I think that you can put those things in place from a policy and practice level within an organization to ensure that that's really how work is moving forward. I think another unique thing, especially when we're talking about environmental justice and health equity, is exposing various disciplines and practices to each other. When you're hiring someone to be a sanitarian, are you sending them out with your nurse home visitors? Are you sending your nurse home visitors out with your substance use disorder team? Are you including your clinical nurses with your sanitarians? How are you making sure that that broader picture is being exposed even at that local public health level? And that your identity isn't, this is the one job I do, but your identity as a public health professional is, it's my role to look at this broader scope and to have this wider vision of how I can help my community. And if I'm identifying this when I'm out in the field for my normal job, how am I making those connections across our department and across relationships with our community? And then recruiting, I think that is a huge step. And I think that we often fall into that education and years of experience, and it's not an or, it's an and I think we really need to get that education and experience to an education or experience, not to discount education, but we really have to increase the value of lived experience and knowledge of community. When we talk about public health, the community is our patient, right? And if we don't have an understanding and a representation of what our community is, then we're not going to be making the right choices for our team. So I think really ensuring that you're valuing that you're building new pipelines and partnerships into your positions in your department is really critical.
And I love the way that we converse about like the future of the workforce, because we understand like public health is going to be a critical need always. And so having folks at the table who have lived experience, who can speak to the inequities and understand the root causes as well, I think that makes a significant difference. I realize that we're running short on time. This has been a great conversation. I mean, I wish I could stay here all day, but I want to leave with this last question around: what are some of the tangible ways that we close the gaps on health inequity and environmental justice? And what is the path to get there? I think it's time for our call to action.
Okay, maybe I'll jump in. I think, it goes back to the intentionality and the action. I think one, it's you have to measure it. We have to make sure in public health that we are really actually measuring the impacts of these environmental exposures within communities. We're already doing that, but we need to make sure we remain focused on that. Trying to get disaggregated data as well. We often lump folks into kind of one group as if all races, which are a social construct, right? It's really just, based on your skin color, all races are not the same, right? They have different experiences, live in different communities. We need to understand through obtaining data and analyzing the data and disaggregating the data, how these environmental hazards are impacting these communities. And then it's about action. It's about putting policies in place, putting your dollars into communities. It's hard work, but it's important work. And then I'll just say too, to the last question, I think it's important, and I again say this often as well, you don't need a degree to be able to know what's going on in your neighborhood. And people in communities are really the experts in what they need, but also in developing the solutions to the challenges. But also, there are assets. We need to not consider marginalized and minoritized communities as just being lacking in fill in the blank. There are so many important resources and assets within communities. So as leaders in our positions who may have some power or resources, we need to understand what those assets are and build upon them as we are moving forward with our work with these communities.
Yeah, absolutely. Oh, sorry, Poppy. Okay. I just to add to that, with data, I think that it's really important that as we collect and organize and have that we also figure out how we're making it accessible and visible to our communities and in a way that's palatable, right? The long reports, that's hard to get through, but how are we really putting that information out there? I think that we can play a really critical role in ensuring that there is that awareness. We talked about workforce development, that's important, but I think even building representative bodies, at least in the local public health level, and I know this extends upwards to the state and beyond, we have governing bodies and boards of health and advisory councils and community councils, and really ensuring that those aren't just check boxes, but having those be critical decision makers in what's happening. I think is another way when you are trying to have that representative voice to do that. And I think it's oftentimes easy to get busy and it's just a monthly meeting, and those need to be more than monthly meetings. They really have to be the work that you're doing in and with community. And then really asking questions. So when you go, we make decisions every day, we make adjustments every day, but when you're doing that, are you asking, who is this action, this plan, this decision impacting? And then once you've answered that question, are you making sure that they are part of the decision-making process? So that's where that experience comes in. And that is so critical. And it's something that everybody can do, right? That doesn't cost anything. You can implement that tomorrow and really have that question be a part of the framework in which you do your work. And I think as public health, and at least in the years I've been in public health, I think we've gotten better at this, but I think we can embrace our seat at the table and live into our expertise. There's so many decisions that happen at the local and state level around, policy decisions around zoning laws or housing laws or other things that we talk about in the social determinants of health, but are we always being really intentional to make sure at the local level that we are living into those roles and having seats at the table, and not just being there to observe and then come back and say, oh, why aren't we thinking about this? But really living into those roles and speaking up and saying, this, when you're changing this, are you seeing how you're impacting this, and how are we putting those things in place? And I think that that's an area where we can really ensure that we're not silent and that we're making sure that we're living into that work.
I would just add, I think pretty much everything has been said. I think I like to keep things very simple. And when we talk about the work of diversity, equity, and inclusion, I always think about, I heard this person say one time that, diversity and inclusion are the inputs and the outcome is equity. And so I always sort of come back to this place of who's at the table, how are they being engaged? and what are the results that we're getting, because we have engaged folks in the right way. So I love what Dr. Khaldoun said about people in community are assets. They should be engaged as such. And also the language around expertise, because I think that governmental entities oftentimes push into communities in this really sort of, for lack of a better way or less charged way of saying it, arrogant way of like, we know all the things and you just need to do what you just need to follow us. And I think that's a huge error. People know. So that's all I'm going to say is people know. I'm not going to even add on to that, right? And then it's how we're engaging people. So I don't want to be brought in after all of the decisions have been made and asked to give a rubber stamp and to be like, yeah, the cheerleader. I want to be brought in at the beginning of the decision process, and I actually want to be paid for my expertise and my work involved. I don't want to be on an advisory that is not paid. Like looking at all of those pieces in terms of how we are engaging folks, that's really where it's at. That's where you get the quality impact. And lastly, I'm just going to say this. I think that it's really difficult to disrupt hundreds of years of inequity and discrimination. But there is a first step for all of us. There is a beginning. And there are two ways that I think about this. One is I pretty consistently ask myself when I'm deciding on something, I look around the room and I see who's involved in that process. And if the room isn't diverse and inclusive, then I scratch it and I start over. That's essential. There should be no decisions being made without diverse and inclusive representation for the folks that we serve. And then second, I ask myself, are we focusing on the process here? So Dr. Khaldoun mentioned this idea and Courtney followed it up with the data. We have to have data. Data drives all of our decision making, but is it the right data? Are we focusing on the right measures? And I would argue that oftentimes we're not. I think we have to really move towards changing how we do things. And that means that our data should largely be around our processes. So I just wanted to put that forward because I believe that that's really important. Less focus on the widgets that we produce and more focus on how we produce them so that we can really get those systems changed. So just wanted to say those things out loud. Thanks, Dr. Bell, for including me.
I knew it was going to happen once. I was going to be on mute. I tried. So I just want to thank you all. I mean, I think this was a critical and necessary conversation, really a great way to kick off the day. So I want to thank Dr. Khaldoun, Courtney, and Poppy for really setting the stage and giving us a way to think about the issues that we're encountering in the environment with a very specific equity frame. And I'd like to, again, thank everyone for attending today's session. And I'm actually going to pass it over to Jim Ostrowski for further instruction. I know we're getting ready to head into our next session.
All right, thanks, Dr. Bell. I just got a screen I'm going to share here really quick, and I want to thank everyone for attending our first session of the day. I want to remind you to please submit any feedback you have on the Whova app. If you got that open, you can click Rate Session and let us know what you think. Our next session for today starts at 11 o'clock, and it's you can access it through the Whova app or through the email that was sent to most of you. EJ and Race, the journey continues. Thanks you all for your attendance, and we'll see you at 11 o'clock.